19th century was full of medical marvels and horrors. Scientific innovations such as the stethoscope, X-rays, and ether were added to the physician's medical arsenal next to the old dependables. Morgan County's first doctor arrived shortly after the county was founded in 1807. Over the next 100 years, he and other local doctors and druggists plied their trades and left behind equipment, medicines, and paperwork. A window into the world of medical practitioners of the era. Seaborn Jones Saffold was one of the county's first doctors. Riding horseback to each patient's house, near and far, it is said that during a malaria outbreak in the early 1800s, he exhausted each of his 4 horses. Saffold was born in 1789, about 45 miles east of Madison. During the War of 1812, at age 24, he was commissioned as a surgeon's mate in the United States Navy, where he honed his medical skills treating wartime wounds and disease. Soon after, he took these abilities to Morgan County and served the citizens there the rest of his life. He left behind quite a few important items, all relating to medicines. His leather saddlebags, specifically made to safely carry glass vials of powdered medicines and other instruments needed on house calls. His portable mechanical equal arm scales, the type of which had been used for thousands of years. His office medicine chest was full of the most trusted remedies for everyday ailments, made from plants, minerals, and chemicals used for hundreds, if not thousands, of years. For colds, fever, and asthma, he had sweet spirits of niter, a very old compound made of ethanol and ethyl nitrite. Also, syrup of squill, a powder made from the squill plant. When mixed with vinegar and sugar, it promoted drainage of mucus in the respiratory tract, especially in children. Coughing, he had camphor, made into an ointment from the bark of the camphor tree and then rubbed on the chest. It has long been an ingredient in today's Vicks Vapor Rub. Camphor combined with soap liniment and alcohol was rubbed on the skin over painful joints and muscles. For inflamed internal parts, such as lungs, brain, or muscles, a blister plaster was applied to the skin nearby. This was made by mixing wax or lard with the powder of dried blister beetles smeared on a cloth. The theory being the resultant skin blister drew blood away from the underlying inflammation. He carried other remedies which followed the belief of the era, that a doctor must balance the various fluids in the patient's body to return him to health. Some of his laxatives were cream of tartar, rhubarb powder, and elixir proprietatis, which was made of the dried juice of the aloe plant mixed with myrrh and saffron. A doctor or druggist made his own pills by using a pill machine. Dr. Saffold possibly made his own cochia pills by mixing dry powder of the plant bitter apple with a soft tree gum, forming into a soft mass, rolling out, then gradually cutting into individual pills, each having somewhat the same amount of active ingredients. Also in the display, a cork press, which was attached to a druggist's or doctor's countertop. To use, a cork was soaked in water, then pressed into this little machine to fit the neck of a bottle or vial. Once inserted, the cork dried and expanded, ensuring an airtight fit. Other items include a glass mortar and pestle for crushing and grinding, a glass measuring cup, a set of cups made of horn, and a small velvet-lined case of instruments of Dr. Ansley and Walker, one of Dr. Saffold's partners. Also, the book's Special Anatomy and Histology, printed in 1843 and inscribed in 1876 to Dr. Gazaway B. Knight of Madison, and a 1904 proclamation by Madison's mayor and council to close all schools, churches, societies, halls, and all public gatherings to be suspended at once due to an outbreak of smallpox. This curious tower of paper is from Vason Brothers Drug Store in Madison, about 1905. It is a chronological filing system for prescriptions referred to as a hornet's nest. Finally, a pair of 19th century protective sunglasses. While this pair is missing its two green side lenses, they were essential when riding a horse or in an open carriage or train. This was the century when trust in the traditional ways of healing slowly transitioned to recognition of science and the medical innovations it brought. But trust in the local doctor was solid. Dr. Saffold's newspaper ad in 1847 stated, "Always ready and willing. Send your messages of sicknesses and death, for we will bring happiness."